When you plan patients for chemotherapy, you have to decide that based on different factors. The most important of it is the type of cancer. So whether this cancer is responsive to the chemotherapy. Some of the cancer is not responsive. Example for that is melanoma and renal cell carcinoma, where they are not that responsive to chemotherapy. Second to that is the patient performance status. You didn't give chemotherapy to a patient where he's very sick or intubated or in ICU or advanced age. So patient should have reserve in his liver function, reserve in renal function, cardiac function to tolerate the toxic effect of chemotherapy. You have to discuss this with the patient family. You have to look to his nutrition status, to his social background, to arrange for him to come to the hospital because most of the chemotherapy is very toxic. So you should have, the patient should have proper support in the local area where he lives. And it usually, the doses depend on the patient body surface, which is calculated by a certain equation. Depends on the patient weight and height. In addition to if the patient had any chemotherapy before, if he had major side effect of the chemotherapy, sometimes the oncologist will decide to reduce the dose if the patient had previous treatment or he had reaction of a previous dose. So with each cycle, the oncologist will decide whether to go with the full dose, 70% of the dose, 50% of the dose, and so on. You will think about some common side effect of chemotherapy because we mentioned at the beginning of the lecture that the chemotherapy, I always say it's blind. It doesn't recognize what is the cancer cell, what's not cancer. So it's given to the patient. It affects other organs, especially the cycling cells. And the cycling cells in the body are, the common cycling cells is the blood cells like RBCs, WBCs, platelet, and so on. Also the cycling cells like mucous membrane cells. So hair, because it's always produced, mucous membrane, you have always changed almost every week. So these cells usually has severe side effects from chemotherapy and came as skin ulcer, sometimes like mucositis in the mucous membrane, in the eye, on the private area, in alimentary tract, and sometimes patient will come complaining of diarrhea, vomiting, nausea, and so on. So in hematological group, it depends on, you will see it depends on the life cycle of cells. So platelet age usually from 7 to 10 days. So you expect to see thrombocytopenia within 7 days of the chemotherapy. Red blood cells, usually the life cycle of it is 120 days, so you didn't see it commonly with the chemotherapy because there is a proper long life cycle for red blood cells. But the WBCs and as lymphocytes, neutrophils, their lifespan is very short, from 6 to 12 hours, and you expect to see them within 2 to 3 days of the start of chemotherapy. And these patients need to be noticed because the patient doesn't have neutrophils, so he or she would not be able to fight infection, and they are prone to sepsis. These patients usually present to the hospital with what we call febrile neutropenia. Febrile neutropenia because they will have fever, they will get infection, but they didn't have neutrophil to fight this infection. They need proper support with IV antibiotics and sometimes admission to the hospital to support it properly.